Hello, and welcome to a new episode of PHI, Public Health Impact. I'm Cham Dallas.
And I'm Phaedra Corso. In today's episode, we are talking about telemedicine, which is a significant and rapidly growing part of the U.S. healthcare system.
Telehealth, or telemedicine, as you know, Phaedra, is a remote delivery of healthcare services using the new telecommunication technologies.
So what kind of technologies are we talking about, Cham?
Well, two-way video, email, smartphones, all sorts of wireless tools that everybody's using already.
And, you know, even though telemedicine has that word medicine in it, it's really not a medical specialty. The products and the services related to telemedicine are actually part of a larger investment in our U.S. healthcare system. It includes information technology and delivery of clinical care.
Well, there's currently over 200 telemedicine networks now operating in the United States, over 3,000 individual sites now in operation. Over 1 million Americans are using remote technology for cardiac sensors already.
And internationally, it's the same thing. We see lots of patients using telemedicine to monitor their vital signs so they stay out of emergency rooms. The same kind of thing we're looking for in public health.
Well, both consumers and physicians are downloading apps, of course, on their cell phones to do this.
In today's show, Cham's going to be talking to a number of UGA professors who are using telemedicine or researching telemedicine, including his first interview with Dr. Pamela Whitten, who is the new provost here at UGA.
And now we're with Dr. Pam Whitten, and something I'd like the people to know is that the head administrator of a major state university like University of Georgia is also a scholar and a researcher. And that's why we want to talk to you about the national perspective. Can you tell us a little something about the national perspective on telehealth trends and policy?
Well, telemedicine's actually been around for a long time. I'm dating myself, but I've actually been doing research, frankly, since the early to mid-90s in the field of telemedicine. And for a lot of years, we experimented with different ways we could use the technology. And very quietly in the last decade or so, much of the technology has just entered the healthcare system seamlessly. So we have electronic ways we access data. We have electronic ways we transmit films for radiologists to read, for example. We have electronic ways people can provide care to people while they're in the home. And so there are a number of applications that are just quietly part of the mainstream, while there are still a lot of applications that we're experimenting with as well.
Well, as most successful researchers do, you're obviously excited about the field. Mm-hmm. What makes it exciting?
It's exciting because it offers a way to increase access and improve health care for people. And that's really what compels those of us interested in health services delivery. There are so many people that just don't have access to various types of health care, from general primary care to specialty services. And technology, like telemedicine, offers one solution for perhaps narrowing the gap between those with access to health care and those without.
So tell us about your work in telemedicine, as well as your research into how this technology can help rural youth and economic development and health services deliveries in rural areas.
Well, the work that I've done with telemedicine has always been with an eye toward how do we understand why and how people adopt this technology, and how do we understand its impact on cost outcomes and health outcomes for folks. And so I've done a lot of telemedicine studies in all kind of contexts, everything from mental health to home health to hospice care to work with radiologists to nursing homes. And what we found, in many cases, some common themes emerge, and those common themes often revolve around just how complicated healthcare is. And technology does not supersede the need for healthcare providers to provide good care to their patients, and patients to comply, with the directions of their health providers as well. But we've also found pretty exciting ways that it can just change the very face of how healthcare is delivered.
Well, as the new Senior Vice President for Academic Affairs and Provost, tell us, what do you think the future holds for telemedicine here at the University of Georgia and in the state of Georgia?
Well, there is a long history of telemedicine in the state of Georgia. Actually, Medical College of Georgia was doing some work with telemedicine back in the early to mid-90s. They were one of the first programs as well to be exploring it. So there's a nice history here of interest and activity. There are a handful of projects going on around the state, and frankly, there are a handful of research-funded projects going on right here at University of Georgia as well that hopefully you'll be able to dig into it at some point. And so there's important interest in work that's going on. There's also real excitement with really expanding that and exploring and working with various health partners and the state in various ways to see how we can really blow that up and enhance the use of telemedicine in Georgia.
Well, telemedicine, telehealth, obviously a growing field here in the state of Georgia. Thank you, Dr. Whitten.
Oh, thank you.
We're here now with Dr. Neale Chumbler, who's the head of the Department of Health Policy and Management at the University of Georgia College of Public Health. Neale, you've been in this field of telemedicine for quite a while.
Yes, Cham. I've been in for about 12 years doing research and program evaluation in telehealth.
So tell me about what's going on with telehealth and telemedicine here in the state of Georgia.
Like Provost Whitten had mentioned, the Medical College of Georgia was where a lot of the telehealth began, and the Medical College of Georgia has been the forerunner in the state of Georgia in doing and implementing telehealth. Also, the Georgia Department of Public Health has been aggressively implementing and evaluating telehealth programs.
Well, in public health, one of the main aspects that we're always after is to increase access to care. So why don't you tell us maybe the two different ways that you've told me that increased access to care is improved by telehealth?
Right. So the big important thing, and especially in a state like Georgia, telehealth has great impact in rural areas. As we all know that many physicians don't practice in rural areas, and so telehealth can deliver health care information, can deliver health care services, and help patients communicate with their providers back in urban areas such as Atlanta.
Another major aspect of public health that we try to get to is to improve the quality of service and to reduce the cost. How's that being affected now by telemedicine?
Right, so telehealth, by communicating with the patient in their home and helping them manage their health conditions, they're able to have greater improved quality of life. And then with the patients not having to go to the hospitals or the clinics unnecessarily, the cost of delivering care goes down.
Well, let's talk about some of the success stories that we've had. That's one of the good aspects of telehealth. Tell us about this Veterans Administration success story that you've worked with over the years.
Right, so we studied veterans all across the country several years ago, and these were veterans who had diabetes, and we provided a little messaging device in their home, almost like a clock radio, and the veterans would input information about their health status and about their blood sugar if they were a diabetic, and that information went back to the nurse, and the nurse made clinical decisions about whether the patient needed to come into the clinic or stay at home and keep managing their conditions. And we found that by implementing that telehealth device, that the veterans were less likely to be using hospital services and primary care physicians.
So tell us now about the success story that you've had in this research in telemedicine with stroke victims.
Right, so we looked at 4 different sites across the country, Atlanta being one of them, where we used telehealth technology, video phones and a messaging device for veterans who survived a stroke and were discharged home. And we taught them how to do exercises because to improve functioning for stroke patients, they need to do simple, basic exercises. But a lot of times when they go home without the proper follow-up, their health does not necessarily improve, but we found that telehealth significantly improved their physical functioning, reduced their falls and their fear of falling at home.
Well, thank you, Dr. Chumbler. It's encouraging to hear how telemedicine is moving us in the right direction in improving health and health outcomes. As we conclude our talk on telemedicine, it's important to know that this new industry is providing new entrepreneurial opportunities as an increasing number of healthcare providers are providing these products.
So to meet this need for new leadership in the field of telemedicine, we want to tell you about a new opportunity we have here at UGA. It's a joint collaboration between the Terry College of Business and the College of Public Health.
Okay, we're back with Dr. Neale Chumbler to discuss this exciting new dual degree program. So these students are going to get both a Master's in Business Administration and a Master's in Public Health.
That's right.
Okay, and what's unique about this program?
Well, there's a couple of unique features. One is that it takes the students 1 year less than it would if they took both programs separately. And it's also one of the unique few programs across the country that have combined both the MBA and MPH in a consolidated curriculum.
You know, Neale, this is such a unique program. How did this come about, such a unique and different approach?
Well, actually, it was student-driven. I had students come to me from both the Terry College and our own college that wanted this dual degree program to happen, so it would position them better for the job market.
Well, what's different about this student population, and where are they going to wind up?
Well, it positions the students to have opportunities to go into healthcare management, and will also develop their more comprehensive public health background if a student comes strictly from a business background.
So essentially we're melding two different cultures to prepare them for the healthcare opportunities of the future.
Exactly. We're consolidating a curriculum, and also with the Affordable Care Act and other healthcare changes going on, that an individual with both an MBA and MPH would be better positioned for job opportunities.
Well, thank you, Neale. Let's go now talk to one of these new students in this dual degree program for MPH MBA. Now I want you to meet Jack Gardner, who's one of the students in this program. Jack, tell me, how did you wind up in this direction? What's your background?
Well, I grew up in a pretty healthcare-oriented family. My dad works in it, my mom's a physical therapist, so it's always been kind of a part of me. And I worked for 2 years doing hypertension, cardiovascular disease research at the Medical College of Georgia. So I just kind of naturally progressed into this the public health field.
So why seek both an MPH and an MBA?
It positions me, I think, a little more for the area or industry that I want to ultimately end up in. It gives me a little more substantiality in the professional world.
All right, but what sort of valuable experiences have you had by doing this dual degree and meshing these two cultures?
What's been interesting for me is getting the public health first. It really acts as a lens for how I approach the MBA program now. It gives me a little more focus and lets me harbor in on what I really ultimately can take away from it.
Well, tell us how your experience in the MBA, the business part of this, has really enhanced this educational experience.
Well, I think that the public health has given me kind of a lens, and so in the MBA, to approach accounting, the finance aspects of it, the kind of the corporate governance and responsibilities of our healthcare industry, it's given me a little more focus and direction for what I want to do.
Well, what are you going to do with your internship? What's the path forward?
I'm really excited about my internship. It's with a company called Booz Allen Hamilton. They're a pretty sizable consulting firm that works in the government contracts, and I'll be working with the CDC. So it really is, it's the best of both worlds. It's the consulting and business world mixed with high-level healthcare.
Yeah, I would say it's an understatement. With both those organizations, they're the two, Booz Allen and CDC are two of the largest in the country. Congratulations, that's really exciting.
Thank you.
But what are you going to do after graduation?
I think initially I want to stay in the healthcare consulting world and kind of figure out what I'm good at, what lends itself to me, and what I truly, honestly enjoy doing, and kind of hone that in, and then potentially spin off and either get into smaller healthcare management or even potentially start my own healthcare consulting practice.
So this approach has given you that much confidence to take the entrepreneurial route.
It has.
Yeah.
It's a lot of knowledge, but it's been really interesting, rewarding.
Well, that's exciting. So what are the highlights? If you look back now, what would be the highlights of your time here, Terry College of Business, University of Georgia College of Public Health?
I really think it's the quality of the faculty and the networking and communication that I've been given access to as a part of this program. I really feel invested in doing this, and my success I think is important to both programs, which is it's a significant thing to me. So I really think just the quality of the experience.
Well, it's significant to us too. We really appreciate it, and we look forward to seeing you move out in this dual degree program. Thank you.
Thank you.
We're here now with Deirdre Kane from the Terry College of Business. And now that we've talked to one of the students, why don't you tell us a little bit about the MBA curriculum side of this dual degree program?
The MBA is designed to give students a broad base of knowledge in a variety of disciplines, and then they're able to pursue specialized knowledge through elective courses. They develop their career management and leadership skills through other unique coursework that's required of them, and then they also get hands-on experience working with companies through one of two project-based courses, the Lean Six Sigma course or the Innovation Projects course.
So who do you anticipate, we've had a few students come in, but who do you anticipate are going to go into this kind of dual degree program?
I would expect it to be people with a demonstrated interest in the healthcare field. And that will, what they're getting from the MPH program is an obvious focus on policy and administration. But what the MBA offers is then the sort of management skills to lead efficiently and effectively within organizations.
Well, what kind of fields do you expect these uniquely educated dual degree people to wind up in?
I think there are three primary career paths that they'll probably consider. Maybe we'll find more, but I think there are three. One is obvious, managing healthcare organizations, improving management. The second would be to work as analysts in organizations, public or private, that are responsible for either financing, servicing, or evaluating healthcare services. And the final thing would be as healthcare consultants.
Okay, so how does one enter into this program? How do you get into this dual degree program?
It's designed as a 3-year program. We expect students to do their first year in the MPH program, and they will apply for the MBA program during that first year. So in the fall of their first year to apply to our program. And do a full year, their first full year in the MPH program. During their first summer, they're required to do a health-related internship. And then they would enter the MBA program and do 1 year in that program. In the second year, the second summer, we hope they'll do a business-related internship because that's the best way to set themselves up career-wise. And then the third year would be split between the curriculum of the two programs, so they'll finish sort of splitting their time half and half.
So how do you anticipate this is going to meet the need of the state and of the nation of this really rapidly changing environment that we're going to be in healthcare and business?
There really is a definite need in Georgia and in the nation for primary care and effective primary care. And so what they'll be able to do is not only understand the policy, sort of the theory, but how to put it in application, the practice, the management practice of that. And so, we have to find ways to provide quality care effectively and cost effectively. And so I think the students going through this program will be better equipped to do that within the state of Georgia, where there's a clear need for good primary care as well as for efficient care and throughout the nation.
Okay, well, thank you, Deirdre. It's going to be exciting to see how this comes out with this unique new dual degree program.
Yes, thank you.
We're at the 2014 Poster Day session for our graduating MPH students, and this is the occasion where they present their research and their culminating capstone project. So I'm here with Griffin Sheets. He's a graduating MPH student in Health Policy and Management. Griffin, why don't you tell me about your poster?
Well, I did my capstone on data from the University Health Center. They collected data from students who were mandated for alcohol treatment. So they got in trouble for drinking, they had a DUI, something like that. They brought them in, they gave them all these psychological measures, things like how many drinks would you have at a variety of prices? And then I compared them on whether or not those students pre-gamed compared to those students who did not pre-game.
Okay, so this is a term I've never heard before. So what does it mean to be a pre-gamer?
Pre-gaming is defined as drinking alcohol prior to the main social event of the evening or day. So the prevalence here was around 40%. It's been as high as 70% in other studies on college campuses.
So what are the main findings of your research?
Basically that pre-gamers drink more at higher prices and at lower prices. And there's a cutoff point around $4.50 where pre-gamers and non-pre-gamers demand for alcohol converge. And so at that point, at around $4.50 per drink, the pre-gaming effect kind of wears off.
So pretty interesting results. Do you have any plans to publish this?
Yes, actually, we're seeking publication right now, me and Dr. Jaya Warden, who is my capstone advisor.
What are your plans after graduation?
I have a job at Triage Consulting, which is a healthcare consulting firm in Atlanta, and I'll be doing healthcare consulting.
That is wonderful. Congratulations.
Thank you very much.
This is Hannah Jane. She's another policy student graduating MPH student. Hannah, tell me about your research.
So I worked with Dr. Gardner in the HPM department, and we looked at varying costs and payments in emergency room services to identify the predictors of payment variation for identical services. So for patients that maybe had an identical diagnosis of sprain, seeing what are the predictors of varying costs for the same service.
What did you find in your data?
So we found that age was associated with increased payment variation, also that being publicly insured or having private insurance was associated with increased payment variation for identical services.
So what are you doing after graduation?
So I was recently accepted to Georgia Regents University to their Masters of Nursing program, and I'm going to earn a certificate as a clinical nurse leader.
Okay, that's great. And so what is your career trajectory in nursing?
So after I finish my MSN, I plan to continue and do their DNP program and earn a Doctor of Nursing practice. Eventually, I'd like to be a professor and do research.
Wonderful. Congratulations.
Thank you.
All right, so I'm here with Erin Gimbirch, and she's a graduating EHS student in our Masters of Public Health program. Erin, tell us about your research.
I am working on studying malaria and the different ways of controlling the malaria vector.
Okay, is malaria something we need to be concerned about here in the United States?
It is not, however, we do need to worry about it in developing countries.
So what kind of data did you use to do your research?
I did a review paper of various methods of controlling the malaria vector, such as DDT, insect repellent plants, and bed nets. Each method that I discussed has various benefits and challenges associated with it. There's a vaccine being tested in the field. However, there are challenges related to that also. But until a vaccine is widely used and available, controlling at the vector level will be the most effective.
All right, so for those of us who are traveling outside of the United States, where would be the place that you would go to where you would be most concerned about malaria?
Sub-Saharan Africa.
And so are there precautions that one can take before they travel there?
Yes, you need to speak to your doctor about getting the proper preventative medicines.
Okay, great. And so Erin, what are your plans after graduation?
I have currently applied to the Public Health Service, and I'm hoping to seek employment there.
Great. Congratulations.
Thank you.
I'm here with Florence Kiza. She's a graduating epidemiology student in our MPH program. Florence, why don't you tell us about your research?
My research was a secondary analysis of a data set, which was a cross-sectional survey that was done in Uganda from 2008 to 2009, and I wanted to find out the prevalence of latent TB infection and associated risk factors in an urban setting in Uganda.
Okay, so tell me, what are some of the most important things that you found?
So my key findings were the prevalence of latent TB infection was 49%, which is almost 50% in this population, and then the risk factors that I found to be associated with latent TB infection were being male, being employed or a student, and age was also associated, and being previously or currently married were also associated with latent TB infection.
So can you explain to me, what do you mean when you say latent TB infection?
Latent TB infection is when you have the mycobacterium that causes tuberculosis in your body, but you don't have any symptoms or signs, therefore you're not infectious, but there is a possibility of you developing active TB, and then you become infectious to the rest of the population.
Great, so Florence, what are you doing after graduation?
I plan to look for a job. I've started putting in applications, and hopefully something works out.
Okay, congratulations.
Thank you.
I'm here with Kelly Truesdell. She is a graduating health promotion and behavior student in our MPH program. Kelly, tell us about your research.
I evaluated a teen maze in Hall County, and I basically looked at past teen mazes that had been implemented in similar target populations. So this one's specifically for middle school and high school students in Hall County. And we looked at effective ones and not so effective, and kind of figured out some implementation strategies that would work for our target population.
Okay, you have to tell me, I don't even know what a teen maze is.
Of course. So a teen maze, it's an evidence-based program that they're doing. And what happens is we gather a bunch of community partners, and it's a first-hand opportunity for students to learn the experiences and consequences associated with sexual behaviors, drinking and driving, teen pregnancy, and it's promoting high school school graduation. And so what we found is that parents, if they have an opportunity to walk through the event beforehand, and some of the community partners that don't want to participate, we're doing a run through so that they can come and walk through the program and experience it and kind of get a better understanding. We also helped redefine some of the objectives of the program to make it clear and help justify program need to stakeholders.
Excellent. And what are you doing after graduation?
I'm going to be, I don't know, we're looking for a job.
Okay, well, good luck to you.
Thank you.
Well, that was a great program on telemedicine, where we also learned about the dual degree program. If you want more information on the MBA MPH program here at UGA, please note the information on the screen.
And thank you for joining us for another episode of PHI, Public Health Impact.